Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about cardiology, heart disease prevention and diagnosis, and the treatment that you can expect here in Covington. We have three cardiologists who'll join us today, Drs. Russell Reed, Paul Stalls, and George Antoon. So we'll start first with Dr. Russell Reed. Welcome to our show. We're glad to have you here.
I'm glad to be here.
So, Dr. Reed, I guess maybe start off with a little bit about your background.
Well, I'm a native from Mississippi. I was originally born in Natchez, and I did my college at Mississippi State, majored in microbiology, and actually got an MBA there as well. Then from there, did my medical training at the University of Mississippi Medical Center in Jackson. I did a residency in internal medicine, and from there went on to general cardiology and trained in interventional cardiology.
Outstanding. And your background actually kind of takes the same arc that many patients do. You started off in internal medicine and moved into the specialized area of cardiology. And I think if we can think about that for a minute from the patient perspective, if we've got good primary care, that may be the first place that we hear about heart disease.
Well, it is, and they're the primary care is important. They are the first line of everybody's care, because they're the ones who know the patients, and sometimes they start with triaging their risk factors and getting their labs and just talking to the patient, and they know the patients, and from there, whether patients come in reporting any symptoms or just in general an annual follow-up asking basic questions about cardiovascular health, if it's something that gets their attention, usually that's what triggers, okay, well maybe this is something we need to explore more and have them refer them to us. I mean, we really depend on them. They're our referral base, but also they take a lot of good care of the patients. It makes sense. Some things that we don't care for, diabetes management and these things. I mean, it starts in primary care, but whenever there's a question or concern, generally there's a pretty low threshold for them to come to us, and that's what we need and what we appreciate.
Well, and I think that's a good point. If I am going to see my primary care provider and I'm routinely doing that annual wellness visit, that we have a tendency to just check that box because our health plan demands it or what have you. But truth be told, that annual visit is really where a lot of this kind of care can be escalated. So the primary care physician hears something from their patient and says, you know what, I think we need to have you talk with a cardiologist. And that's a little bit of a transition that takes the patient to a whole new place. So let's say my primary care physician has decided that I need to come see you. Tell me what that initial visit's going to be like.
Well, a lot of it is just going off of what's already been talked about from the primary care. It may be a very mild symptom, and it's our job to tease that out and get into the details of, okay, exactly what's going on. A lot of times by the time they get to us, they already have some lab work, and we always discuss that, discussing risk factors and lab work, and looking at cholesterol and blood sugars and those things to see what they look like, to see how that fits, really getting into their risk factors. And that's where it starts in primary care. We really try to break down those risk factors, say, okay, it's a lot of talking and teasing out, okay, what is your risk of whatever this symptom is actually being a cardiac issue? And so it's a matter of getting down to the symptoms and details, but also looking at the risks, looking at those risk factors and putting those two together. So, okay, do we have a real cardiac issue here that we need to get into, or is this something, okay, well maybe this isn't as serious as you should be, but that's where we really have to have an honest discussion and really get down to brass tacks about what's risk factors and what's going on.
Well, let's break that down. First, symptoms and then risk factors. So what are some signs and symptoms that people should be aware of?
Well, they're the textbook symptoms that you can look at, whereas we always ask basic questions of, okay, chest pain, shortness of breath, do you feel any palpitations? Those are very broad, but sometimes it's a lot more nuanced than that. I always ask about chest pain, but pain can be anything. It's very subjective. It's whether it's chest pressure, tightness, pulling. I mean, it can be a whole list of things. You know, I always tell patients, there's no wrong answer. Whatever you feel, you feel. That's my job to try to sort it out. And because it's not always the same, especially in women. The symptoms aren't always the same. Sometimes it's just as vague as, I don't feel like I should, or I was doing some work around the house or doing some yard work and just didn't feel like I could go like I used to. And that's where it's on us to have a low level of suspicion. So, okay, well, there could be something here that's, people are stubborn, and sometimes they don't admit when they're feeling bad. And so that's where we have to be a little more aggressive and make sure that we're getting the right information and then doing the right tests. And onto the question about risk factors,
right.
That's where that comes in too, because knowing people's risk factors, and patients need to know and what their risks are. High blood pressure, diabetes, if they're a smoker, of course here obesity is a big problem, or just general sedentary state. Those are all things that play a role. Of course, family history you can't do anything about, but it's important. We always have to ask about that. And so when you put symptoms and risk factors together, that will determine what we need to do, how aggressive we need to be. And of course, when you come into our office, we're looking at your blood pressure. We're going to go over labs. You'll have an EKG, so we can look at that. And then depending on how the visit goes and what you say, we'll determine what other kind of tests we need to do.
Okay. So basically, if you take all of those signs and symptoms, you take those risk factors, you have that conversation with the patient, then you're going to do some testing.
Right.
So can you describe a little bit about what kind of testing people can expect from the cardiologist?
Well, it can vary. There's a wide range depending on how aggressive we need to be. Sometimes it's as simple as, look, all you have is the EKG and you go about your way and we'll check on you in a year. Or sometimes we get in there and red flags start going off and say, look, we just need to go and do an angiogram straight off the bat because I'm worried about, with your risk factors and your symptoms, I think there's something bad going on. But generally, sometime in the middle, it's not uncommon where, hey, let's just start with a stress test, maybe an echocardiogram, which is an ultrasound where we can actually look at your heart structure and function and valves and make sure that's in good working order. Of course, always good to get people on the treadmill with a stress test to see what their exercise capacity is and to see if that tells us anything. And then we move from there. A lot of it is medication adjustments, all in the name of making sure that your symptoms are taken care of. We're not missing any bad cardiovascular disease, and of course having a good lifestyle, being able to function like a real person.
Absolutely, we all need to function like a real person. That's why we need good heart care. Okay, so you're going to take those signs and symptoms, those risk factors, you're going to maybe do some testing, things like an EKG or treadmill stress test, right? Up through maybe an angiogram. And that's going to tell you what that patient needs next. And it may be intervention, or it may be medication, or it may be some combination. But it's almost certainly going to involve some diet and exercise and some good healthy choices.
Well, always.
Very good. Well, I appreciate all of this information. I think you've helped us understand what we should be watching for in terms of our own heart health and how we can find our way into cardiology through primary care. Thank you, Dr. Reed. It's been a pleasure to have you on the show.
Thank you for having me.
You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking about heart health today and learning about the specialty of cardiology. We'll be right back.